Psychopathology disorder. I present the topic of psychopathology in this video presentation by beginning with a look at definitions of abnormality and the historical development of this discipline. Psychopathological disorder is a term which refers to either the study of mental illness or mental distress, or the manifestation of behaviors and experiences which may be indicative of mental illness or psychological impairment. Psychopathology comes from the word psyche, means mind, soul, pathos, means suffering, and logos, means study. Psychopathology, also called abnormal psychology, studies the causes, treatment, and consequences of psychological disorders or mental illnesses such as depression, anxiety, and psychoses. Before we start, it is important to notice that this is a major area of psychology, with links to wider clinical practices such as psychiatry, psychiatric nursing, social work, and the medical sciences in general. However, the contribution of psychopathology to our understanding of individual differences cannot be neglected. Differential psychology attempts to explain differences between individuals, and such differences can often be explained in terms of mental illness or psychological disorders. Although this may suggest an overlap between personality and psychopathology, there is a distinction between the two. Whereas personality refers to individual differences in general or normal behavior, psychopathology focuses exclusively on abnormality. Nature of psychopathology. A psychological disorder is an ongoing dysfunctional pattern of thought, emotion, and behavior that causes significant distress and that is considered deviant in that person's culture or society. Types of psychopathology. Some of the different types of psychopathology include, but are not limited to, anxiety disorders, bipolar disorders, depressive disorders, disruptive, impulse control, and conduct disorders, dissociative disorders, eating disorders, neurocognitive disorders, neurodevelopmental disorders, schizophrenia spectrum and other psychotic disorders, obsessive-compulsive disorders, sleep disorders, somatic symptom disorders, substance-related disorders, trauma and stressor-related disorders, personality disorders. Causes of psychopathology. There is not a single cause for psychopathology. There are a number of factors that can increase the risk of mental illness, including biological factors, including genes and brain chemistry, chronic medical conditions, family members with mental illness, feelings of isolation, lack of social support, substance or alcohol use, traumatic or stressful experiences. Intervention and therapies. Based on the study, they identified therapies according to different therapeutic approaches. Cognitive behavioral therapies. Cognitive behavioral therapy, CBT, are a group of interventions that draw on a number of theories of learning, both to account for and address a range of emotional, psychological and behavioral problems. Behavior therapy refers to a range of treatments and techniques which are used to change an individual's maladaptive responses to specific situations. Modeling is a process that occurs during social learning. Social learning theory recognizes that we are not simply the product of our environments. We do not simply respond to stimuli, we interpret them. What we think influences what we do and how we respond to other people and events, and our experiences lead us to expect certain outcomes from certain courses of action under certain circumstances. Trauma-focused CBT, TFCBT, directly addresses traumatic symptoms, alongside other components that are typical of CBT interventions, such as coping skill training and symptom management, cognitive restructuring and gradual exposure. Eye movement desensitization and reprocessing, EMDR, involves the identification and processing of traumatic memories using bilateral stimulation, desensitization through imaginary exposure, and challenging and replacing maladaptive beliefs about the trauma. Relationship-based interventions, RBIs. Attachment-orientated interventions describes an infant's strong disposition to seek proximity to and contact with a specific figure and to do so in certain situations, notably when frightened, tired, or ill. Attachment and biobehavioral catch-up, ABC, focuses specifically on disorganized attachment styles, which are associated with frightening or frightened parental behavior rather than purely a lack of attunement or insensitivity by the parent. Parent-Child Interaction Therapy, PCIT. It was designed to help parents to establish a secure and nurturing relationships with their child, and enhance prosocial behavior while decreasing undesirable behavior. Parenting interventions in general. Parent training interventions aim to change unhelpful or maladaptive parenting practices in order to improve child development and well-being. Dyadic Developmental Psychotherapy, DDP. The intervention uses the child-therapist relationship to establish a relational context in which the child can learn how to engage with, and benefit from, relationships with others. Systemic family therapy. There are many forms of thought, most of which are informed primarily by structural family systems theory and drawing on a wide range of techniques from other interventions, such as CBT, cognitive behavioral therapy. Trans-theorical intervention. This intervention, based on trans-theorical model or TTM, was designed to guide intervention methods to change dangerous behaviors. Multisystemic therapy, MST, is a short-term, multifaceted intervention for children and young people with serious psychosocial and behavioral problems. Multi-group. It differs from family therapy, FT, in that it includes a combination of multiple systems in the treatment focus, such as family, peers, school, neighborhood or community. Family-based program provides immediate assessment, support, and crisis counseling to individuals, couples, and families experiencing an event or situation that is overwhelming or traumatic for the family. Intensive service models. Treatment foster care. Enhanced foster care is designed specifically to meet the developmental, social and emotional needs of children in foster care with particularly challenging behavior. Therapeutic residential per day care. Like milieu therapy, therapeutic residential care entails creating a nurturing, stable and consistent environment and a predictable routine for children and young people who need specialist help, and whose problems make it difficult to provide that help in any other way. Coordinated care refers to interventions designed to provide a single point of entry to services, combined with a seamless system of service delivery. Activity-based therapies. Art therapy. Children who have been maltreated can find it difficult to verbalize their experience, and may feel intimidated by the therapeutic environment and overwhelmed by the verbalization of abuse experiences. Play or activity interventions, depending on the age of the target population, are based on the premise that play and activity are vital for healthy development. Play therapy views play as a natural medium in which children express themselves. Animal therapy, or animal-assisted therapy, uses animals as part of the therapeutic process. Animals, from dogs through to horses, are used to assist with the therapeutic process and strengthen treatment strategies. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood.